will be labeled as our andrology 2. All right, so yesterday was still part of andrology 1. Today we're going to look at some of the common conditions, physiological phenomenon, functional defects, diseases, disorders that are associated with the male reproductive system. So you see that it's also a long haul. All right. Before finally you get to the semenology. So you see that the semen is just a fraction of andrology. And so those of you who actually took part in the semenology or semen workshop, you see that this is, of course, quite different. All right. So you're going to look at organ per organ. All right. So the conditions, the physiological phenomena, all of them, you're going to look them one by one with respect to. Am I online? Please, can you hear me?
Yes, please, Grandpa. We can hear you.
Grandpa, we can hear you.
All right, so we're moving on. You're going to look at the common conditions, like I said, and then we're going to take them one by one. And our first organ to consider is the penis. And we're going to look at the normal physiological phenomena, some of the things that are normal with the penis. All right, so today is going to be basically the normal physiological phenomena or processes that are associated with the penis. They are normal, and once they are normal, they are normal. So what we're going to talk about are the normal things that we expect of the penis. Then after that, you go to the disorders and what have you say with the penis. All right. So one of the normal phenomena associated with the penis is, of course, is with erection. All right. So you have a situation either it is erect or non-erect. One, it is not erect, we call it flaccid. Flaccid. So a flaccid penis is the one which is at rest in its normal state, hanging loosely and stuff like that. So once it is, it has become enlarged, it is rigid, which all of us know about, it is supposed to be an erection. The essence of it is to facilitate sexual intercourse. That doesn't mean that whenever the penis is erect, you have to go in for sex. No, that's not it. But in nature, by nature, we realize that the penis is the conduit, the means by which the sperm that are produced will get into the female genital tract. All right, so that's where to make that procedure successful, the penis will have to be in a rigid form that will allow for penetration. I'm saying that it doesn't mean that whenever there's an erection, because there are a lot of situations that could cause the penis to erect without necessarily for sexual intercourse. All right. So for now, I'm sure you know this already. Once the penis is not erect, it is called flaccid. And that is that. So this a gentle penis in its flaccid state, that's at rest. Right. So most of the time, the penis is at rest, it's not firm, it's not rigid, and it is called flaccid penis. All right. So what are some of the clinical terminology? As we are in medicine or we are in the medical, we are within the health sector, you have to understand some of the language within the clinical context. So normal erection is everyday English, and everybody understands it. But clinically, the term for it is penile tumescence. peniatumesis. So you can either have full penises erection or partial, that is as if, especially as you age, a lot of things go bad, and then your penis will be erect, but you see that it's not fully erect. So that is semi-erection. And also technically or clinically, it's called partial tumesis. So tumesis is the clinical word for erection. And if you say, in actual, if you say an erection, I mean, anything can erect. You can erect anything. So sometimes it is good to so then that's where you can't be bringing the penal, not to, for example, if you find yourself in the court and say erection, the magistrate or whoever will just, what is erection? Erection can be anything. Okay, so if you say penile erection, then you're emphasizing that you're talking about the penis being rigid, being stiff, and stuff, so forth and so on. So these are some things. Sometimes you take certain things for granted. You need to know that if you say erection, even though everybody understands that it is the penis, that to be very sure not to allow anybody to just interpret it anyhow, just give it penile erection, or for that matter, peniatumesis. Right. So the return of an erect penis to its flaccid flaccid form, and we have said that already. It's called peniatumesis. Sorry, just a minute. I'll come back. I'm back. I had some emergency call. I needed to respond to it. Sorry. So we're saying that tumesis is erection. If it becomes peniatumesis, the word D means removal. All right. So dehemoglobinization, removal of hemoglobin. Deamination, removal of amines. And that kind of, so if you do a little bit of medical terminologies, these are things that you know easily. That for every medical terminology, there's a prefix, there's the root of the word, and then there's also a suffix. Some words don't have suffix. For example, detumesis, it doesn't have a suffix, but it has a prefix. The prefix is D, And then tumescence is the erection. So D means removal. So removal of erection means that the penis is no longer erect. It means that it's coming back to its natural form. So detumescence is the same thing as flaccid state. I mean, after erection, there should be sedation of it. Now, when we come to disorders, we are going to look at if there's a failure of detumescence. What is it? Then we can also talk about it. For now, we are looking at normal physiology. So we are looking at the normal physiology. So we are not going to look at if there's failure of detumescence, right? So how erections occur? How do you get erection? So erection occurs as a result of blood engorgement of the penile erectile tissue and consequential arterial congestion of the. I'll explain that. What it means is that the penis, if you take a cross section of it, it has tissues in there, and those tissues are erectile. Okay, they have erectile functions, and they're also spongy. So it means that there are spaces in between. Now, those spaces in between can be filled with blood. Now, once you get blood flow into that erectile tissues, then of course they will have to enlarge, and then they become stiff, and we are going to talk more about that. But that is basically about how erection occurs. There's blood engorgement. When you say something is engorging, it means that it's accumulating blood in there. Now, how is it that blood doesn't flow? It gets accumulated as we move on with the discussion, we talk about that. All right. So once blood gets into the erectile tissues of the penis, then it will become big, it will enlarge, it will be stiff, it will be hard. These are all the expressions of what we call an erection. All right. Now, penile erection may occur not only during sexual activity. All right. It's not only that, you have to get erection only when there's a sexual arousal or something. No. But other contexts, such as simple manipulation or physical touch or stimulation of the penis, which you call reflex erection. What it means is that you can be holding your penis, somebody can touch you, and all those small things without necessarily having in mind of a sexual activity. You can there could be an erection, and that's called reflex erection. When there's a touch, when you yourself will sit down, sometimes, especially young guys, they just want to have fun. They will just be stimulating the penis, and then before you could say Jack, they have erected. That is not necessary to go into sexual anything, right? So there's also erection can occur during sleep. You talk about all these things during sleep. You haven't there is no intention for any sexual activity. Before you could say Jack, the penis has erected. We'll talk more about all this. We call this nocturnal erection. Okay. And then we have what we call induced erection, erotic fantasies. Erotic, when you say something is erotic, that have something to do with love or sense, that kind of, yes. So we have erogenous zones, for example, and as scientists, you should know what are erogenous zones. You see, this erotic. It has to be. So the word error got to do with love or anything sexy, okay? Anything sensational or sensitive, right? So when you say erotic, Fantasies is like when you are imagining, thinking some funny thing, and it's also erotic. So it means that sometimes you'll be sitting there and then you'll be thinking about how some time ago you had some feeling with a certain lady and blah blah. But before you could say Jack, you have erected. Or you can be dreaming that, oh, if Miss Ghana GMB, if this, I wish I could have this lady by my side. And before you could say Jack, those are fantasies, but it has erotic connotations. All right. So before you could say Jack, this lady, you haven't even seen her before. You only saw her on TV. But you are imagining that she could be your girlfriend and blah, blah. Because you could say Jack, then you have erected. These are called induced erection. So as scientists, you should know some of these terminologies and then you can explain. All right. So we have had reflex erection, you have had nocturnal erection, you have had induced erection, and I'm sure you know all these things may not necessarily lead to sexual intercourse. Right. So this is the erectile tissues, because we've said that the erectile tissues will have to be engorged. So you should have an idea about what is it. So let me see if I can, right. So over here, of course, this is the penis, the entire organ here is the penis. Then of course, you know this one as the urethra. Okay. And then immediately after urethra, there's a tissue here. This is the corpus spongiosum, this one. So the corpus spongiosum is directly linked with the urethra. Now, then the bigger one is the corpus cavernosa. So the corpus cavernosa, if you look at this picture, you see that the corpus cavernosa will be two. If you look at this one, because the urethra is lined by the corpus spongiosum, like this. All right. So in that case, then the cavernosa will be here and will also be on the other side, like this one. So we say that it has three erectile tissues, but basically it is the cavernosa here, which has been split into two, and then line in between with the spongiosum. I hope you are following it. So these are the, and this typically it is this one which will be filled with the blood vessels, which will be filled with the blood for the engorgement and so forth and so on. So I'm sure you can appreciate that. It has three erectile tissues, but two are the same. The one here and the other by this side here. This is the cavernosa, the corpus cavernosa. The spongiosum is just lining the urethra. All right. And so it is the same thing which is lining the urethra straight by this way, and then the cavernosa here. So we have two of the cavernosas and one of the spongiosum. I'm sure you appreciate that one. So let's try to appreciate or understand the erection bit more properly. So now when you talk about the corpus cavernosa, you know what it is. This is the erectile tissue lining left and right of the penis. And it is this one which will be filled with blood that will cause the engorgement. And for that matter, the enlargement and the rigidity of the penis in the phenomenon we call erection. Right. So let's see how the whole thing is initiated. So erections are initiated and maintained by two main processes. There is the relaxation of the arteries of the corpora cavernosa to allow increased inflow of blood. What it means is that you know that it is arteries are those that supplies organs. This is basic anatomy and physiology. Is the blood from the heart. pumps through the arteries. And so they supply the organs. So the penis will be supplied with arteries. Okay. As we move on, we'll talk about the specific name of the artery. So it's the arteries which will go. And then once the blood has entered any organ through the arteries, blood will leave the organ through the veins. All right, through the veins. So arteries will supply and veins will go out. Now, there's going to be a certain phenomenon when there's a relaxation. Whenever arteries are relaxed, when they are relaxed, what it means is that the muscles are relaxed, and then the tunnel, I'm sure you imagine, you know what an artery is or a vein is. When the veins, or for that matter, the arteries are relaxed, then it means that the hole within it becomes larger because they are relaxed. So once they are relaxed, they become larger. Once they become larger, it means that more blood can flow in there. All right, so that's the first thing. There's a relaxation of the arteries that supply there. Remember, we are talking about the corpora cavernosa as the erectile tissue that surrounds the penis. All right, please try and follow it step by step so that you can appreciate the whole phenomenon. So the arteries that are supplying the penis, and once there's a relaxation of the arteries, then it means that the hole the hole within the arteries will be bigger because there's a relaxation. Once they become bigger, because they are supplying the blood, then the blood flow will be increased. As simple as that. And once the blood flow increases, they will move into the corpora cavernosa, which is the erectile tissue. Now, once they move in there, then you know that whenever there is an artery, there's also a vein. All right. So the arteries will supply into the vein. Now, it's like when you are when we move to prostate, you talk about prostate. When the prostate becomes large and large, you see that the urethra in it will become smaller. When you have something which is becoming big, they will impinge on the hole within. All right. So if you have the arteries that are becoming bigger, they will seem to impinge on the veins, so that now the veins will now be constricted. I hope that you are following the debate. So the arteries have relaxed, and there is a lot of blood going in there. And once they are by side with the veins, then it's like they will impinge on the veins. So the veins become smaller. Okay, once the veins become smaller, it means that the blood that is supposed to go out from the veins will be impaired. So we call that venous occlusion. Okay, you are occluding. It's like you are virtually closing the space within the veins. All right, so this is what happens. There is an increase in the blood flow into the arteries. The arteries become bigger and large, and then they will impinge on the veins, so that the veins are almost collapsing. So once the veins are almost collapsing, it means that they cannot take away blood from the penis. And so once they are not, too much blood is coming and only very little is leaving, then it means that the blood will stay in the penis and cause an engorgement. So it is this engorgement that also results in the enlargement, and then the stiffness, and then the hardening of the penis. And so that's the mechanism. So this mechanism is called veno-occlusive mechanism, and that results in the penile erection. I'm sure you followed it. All right, thank you. If there's anything somebody wants better and further explanation, please alert me. All right, so this is a picture of flaccid penis and then an erect penis. All right, so here we have in the flaccid state, remember you are talking about the corpus spongiosum, is the one lining the urethra. What is of interest to us as far as erection is concerned is the corpus cavernosa. All right. Now, when the when it is flaccid, what it means is that the arteries will be constricted. You see, and we are going to talk about what will cause the artery to be constricted or contract, and what will cause it to also relax. Right? So once it has constricted, that means that blood flow into the corpus cavernosa will be limited. And once blood flow is limited, it's only the blood engorgement that will cause it to expand. So once there is the arteries have not expanded, and for that matter, blood flow is limited, then it means that the penis will be in this flaccid resting state like this one. Now in the erect, over here, the arteries have expanded, all right, and then it is allowing more blood. Once it allows more blood, it impinges on the arteries. Once it impinges on the arteries, blood flow out of the penis will be limited, and then all the blood will remain in the penis to cause it to erect. It's very, very interesting and simple. Right. Now, still on the physiology of penile erection. Erection, ejaculation, I'm sure by now you know the difference. A lot of people, when they are talking about erection, they will say ejaculation. When they are talking about ejaculation, they say erection. I'm sure erection is just the stiffness of the penis. Ejaculation is the way semen is produced and then sent outside the body, right? So the two are completely different. Now, but these two phenomena are under the autonomic nervous system, the ANS. I'm sure you can cast your mind back. The autonomic nervous system is made up of the parasympathetic nerves and then the sympathetic nerves. I'm sure by now it is something that all of us know already. Now with the sympathetics, you are talking about something that will cause stress. Just not that it will cause stress, but for the fact that you can easily relate. I always like mnemonics. I'm sure you understand mnemonics. Mnemonics spelled MNEMONICS. 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 M, not T. MNE mnemonics. Mnemonics is something that you always want to use to help you to remember something. Okay, right? Just as we talked about the luteinizing hormones and the Leydig cells, and then follicle stimulating hormones, and then the Sertoli cells. Okay, so where there's an S and S, and then where it's an L and L, something like that. Right? So sympathetic and parasympathetic. Sympathetic S, stress. So whenever you are stressed out, you want to move out. Okay, so it is sympathetic innervation. For that matter, sympathetic nervous system controls what we call fight and flight. All right, because you are stressed out, you want to go out, you want to fight, you want to do something. So we'll let you to move out, and for that matter, will spend a lot of energy. If you want to move out, you have to spend a lot of energy. So you see that the sympathetic nervous system uses a lot of energy. Okay, and it is for flight or fight. That is what I'm sure a lot of you are aware of. The fight and flight. Parasympathetic paralyze. when you are paralyzed, you can move. You are resting. So parasympathetic listen is for rest. All right. You are not doing anything. You are at rest. All right. So these nervous systems, these two, which one will control erection and which one will control ejaculation? Right. So as we said, the sympathetic pathways are anti-erectile. What does it mean? It means that they don't promote erection. The sympathetic nerves, you understand? Because they always want to move or fight. You need to spend a lot of energy. And you spend energy, muscles will have to be contracted. You need to contract muscles. If you want to move, you need to contract muscles. So you see that sympathetic nerves, sympathetic pathways will promote contraction. All right. Remember, we said that for the penis to erect, the arteries will have to relax. Okay, so if you use the sympathetic pathway, they will rather contract the arteries. When they contract the arteries, what will happen? The holes in the arteries will become smaller, and therefore blood cannot flow through. If blood doesn't flow through, can it cause engorgement? Of course, no. So these are the way to appreciate it. So when it says sympathetic pathway are anti-erectile, it means that they don't promote erection. All right. How about the parasympathetic pathways are pro-erectile? What it means that with the parasympathetic pathway, they are relaxed because you are resting. Remember, we said that sympathetic got to do with fight and flight, where you are always, there's energy consumed. You want to fight, you want to move, you want to do something. And that means that you need to consume energy. That means that muscle has to be contracted. All right. In the parasympathetic, we say they are paralyzed. So they are moving, they are at rest. When things are at rest, it means that they are relaxed. So it is this component that will now promote erection because you want the arteries to be relaxed. When the arteries are relaxed, the holes within the artery become bigger so that blood can move in there and then can cause erection. So this is the way to appreciate it. So it means that sympathetic nervous system will not give you an erection, rather the parasympathetic. I'm sure you have taken note of that. So the sympathetic contractile factors maintain flaccidity, and flaccidity is the same as being flaccid. That is what it is. And being flaccid means that the penis is loose, the penis is not. So it means that most of the time, the penis is controlled by the sympathetic nervous system. Because I'm sure most of the time, unless some few people who want to have erection almost every time. Otherwise, most of the time, some of us, sometimes the whole day cry, no erection. Okay. So if there's no erection, it means that there's a sympathetic pathway which is now dominating. Because the two are always opposite. Sympathetic and parasympathetic, they are always opposite. If one is doing this, the one is doing the opposite thing. So once most of the time the penis is loose, it's in a flaccid state, it means that what is in action is the sympathetic nervous system. All right. While the parasympathetic factors induce smooth muscle relaxation. Remember, you said parasympathetic talk about being at rest. All right, being at rest. And you see that in that scenario, when you are at rest, digestion and all those things take place. So digestion is still under parasympathetic nervous system. Okay, right. So if you want to give examples about parasympathetic phenomenon, you're talking about sleep, you're talking about digestion and normal heartbeat and stuff like that. They are all parasympathetic. So I'm sure this slide it looks technical, but I'm sure that you have understood it. If there's something that you don't understand, please let me know. That erection is promoted by parasympathetic pathway or the parasympathetic nervous system, which is an aspect of the autonomous nervous system or autonomic nervous system. Now, because the parasympathetic pathway or factors promote relaxation. Once they promote relaxation, it means that they will also promote the arteries to be relaxed. When the arteries are relaxed, it gives way for blood, a larger blood volume to flow into the penis, and that will cause it to become erect. So still on the parasympathetic stimulation, there's a clause which says that parasympathetic stimulation is excitatory. When it is excitatory, it's exciting. It means that the penis is happy to be under the influence of parasympathetic stimulation. And you know, once the penis is erect, it feels comfortable in the erection state than being flaccid, even though most of the time it doesn't have to be erect. You understand? So if you come across the phrase that parasympathetic stimulation is excitatory to the penis or for the penis, what does it mean? What it means is that it promotes erection. And once it promotes erection, it means that the penis is excited to be under the influence of the parasympathetic pathway. I think it's the same thing that we are going over and over. I just want you to appreciate or understand it better. So, in effect, the erectile function of the penis is under parasympathetic control, and ejaculation is under, because in ejaculation, you need the muscles to contract so that they can push the semen along. All right. So, I just brought that one here so that you can know the difference between sympathetic and parasympathetic with respect to ejaculation and erection. I think this is still a repetition of what I've said over. The parasympathetic stimuli relax the smooth musculature of the corpora cavernosa and produce vasodilation in the helicine arteries. So here you know that the arteries that supply the corpus cavernosa is the helicine arteries. Okay, so this one, helicine arteries, which will become relaxed and of course become dilated to cause more light, so to cause more blood to flow in there. All right. So as I said earlier, when the arteries, and for this matter, the helicine arteries, when they are filled with the blood in the corpora cavernosa, and I'm sure now you know where these are the erectile tissues in the penis. So they compress upon the venous outflow. And once that happens, I think I've explained this already, they cause venous occlusion, and which will result in the engorgement. Finally, we want to ensure that there is something which is happening that will cause blood to be engorged in the penis. Okay, so for this thing to happen, the inflow should be encouraged, outflow should be discouraged. That's all. All right. All right. So more explanation on the erection. So when you have a flaccid penis, this is what happens. The arteries are constricted and there's very little blood flow into it. All right. Whilst with the erection, the arteries are dilated, allowing more blood to flow in there, and then gorging. And like we said, the the impinge on the veins to make the veins smaller, to allow the blood to be retained to cause the erection.
Hello, sir. Hello, sir. Hello.
So, say more examples of the penile erection. So,
hello, sir.
I'm sure there's no need to emphasize this one again. To the extent that when there's an erection, blood is engorged. It's the engorgement or the trapping of the blood in the corpus cavernosa that will lead to the erection, right? Now, there's another interesting
Hello, Grandpa.
information that you have to know.
Hello, Grandpa.
Now, there are what you call neurotransmitters. When you deal with the neurons.
Hello, Grandpa.
All right. You have what you call neurotransmitters or messengers. Now, when there is sexual stimulation, which will actually lead to the erection, the neurons are stimulated to produce nitric oxide. So it is important to know some of these things because at the end of the day, as scientists, you should appreciate why certain drugs are used in treating, let's say, erectile dysfunction. So why certain drugs are used to treat sexual dysfunction, also erectile dysfunction. So here you are talking about nitric oxide. It's very, very critical in managing erectile dysfunction because you see that nitric oxide plays a key role in causing erection. Because we said that we want the arteries leading to the erectile tissues, and for that matter, the cavernosal to be engorged. And for that matter, they should relax. Something should cause it to relax. All right. So it is these neurotransmitters. And the main agent, the key neurotransmitter here is the nitric oxide. So the nitric oxide, once they are released by the neurons, then they will also now, it's like coagulation. They will also cause a secondary messenger called CGMP. That's the glycine monophosphate, to also now cause the muscles to relax. Okay, so we are not going to go deep into that, but I just want you to appreciate the fact that nitric oxide plays a key role in erection because we are saying that this whole system is under parasympathetic pathway. And when there's parasympathetic pathway, you want a relaxation. When you want it to relax, then some transmitters should impinge on the muscles to relax. And you are saying that as far as erection is concerned, it's the nitric oxide which plays that role. So here you say the principal or key physiological neurotransmitter or agent responsible for relaxation of penile smooth muscle or penile erection is nitric oxide. This is very, very important information. Sexual stimulation or arousal triggers the release of nitric oxide as neurotransmitters or messenger molecules from the nerve terminals and blood vessels. I'm sure this is also something that you can easily appreciate. So, like I said, once the nitric acid has now been released by the neurons, all right, then this is also to now push on another secondary messenger, the CGMP, all right, and then this will now also cause the smooth muscles to relax. And I'm sure that you understand from that angle. Once the relaxation, the arteries become dilated, then blood vessels will, the blood will move in there, and then there's this veno-occlusive phenomenon, which will now also prevent the venous blood from leaving the penis and then causing engorgement, for that matter, leading to the erection. So in summary, in the resting state, the helicine arteries, and I'm sure that you are talking about specific arteries that are in the corpus cavernosa, which is in the major erectile tissue in the penis. All right. So in the resting state, the helicine arteries remain constricted, limiting blood flow to the erectile tissues. This in summary, all that we talked about in summary. Now, so that's in the resting state, the arteries are constricted. When they are constricted, they limit blood flow into the tissues. And for that matter, there will be no erection. During sexual activity or sexual stimulation, which could be visual, tactile. When I say tactile, we're talking about touch. Now, that reminds me, when I was explaining the erotic fantasies, I needed to end at something, but I think it escaped me. So let me go back before I forget again. So erotic is about something that has got to do with love. The Greek word for eros is love. So ero, the E-R-O, whenever you have prefix ero, it means that got to do with love, something sensational, sexual, and so forth and so on. When you say erotic, it means that it has the tendency to give you some sexual arousal or something like that. Now, I was going to say that we have what we call erogenous zones in the human being. All right. So the erogenous, the word ero, like we said, talk about love or sexual. All right. And then genus means what? When you say exogenous, endogenous, producing. So erogenous means something that produces, has a tendency to produce a sexual effect or a love effect. So as scientists and as mature as we are, we have to know what we call erogenous zones. We'll talk more about that when we're dealing with the prostate. As prostate being an erogenous zone, there are certain portions of the body that are so sensitive. All right. So, for example, the penis, the glands. I'm sure you know the gland. The head is so sensitive, and so whenever you touch it, you are supposed to get some sexual stimulation of a sort. So in that case, the penis, the glans penis becomes an erogenous zone. I'm sure women, the clitoris is an erogenous zone when certain areas are so sensitive, and as soon as we touch it, when you touch it, that kind of how do you call it, sexual stimulation of a sort. How do you get it? There are a lot of erogenous zones with every man and woman, and I'm sure you know that there is this concept in women called the G spot. And like I keep on saying, you're all matured and you're all scientists. You know, the G spot is one of the areas or zones that women will easily get stimulated. All right. And a lot of other places. So it was when we were talking about the erotic that I remember that I should have added the erotic and the erogenous They are talking about the same thing. Erogenous are zones, or erogenous zones are areas that have high sensitivities to touch, and they have a tendency to cause sexual arousals. So examples talk about the glans penis. There are so many points, and with women, I've talked specifically about the G-spot. So you can read a little bit about the G-spot if you don't know. Even the nipple, the breasts, and all those areas, when you touch, somebody will feel sensational, and that is, so we call those areas erogenous zones. Erogenous zones. All right, so now back. So in sexual stimulation, and it can be visual. You can look at somebody and then feel that you want to have affair or something. So it can be tactical, touch. Somebody will touch you, and then somebody will speak something into your ears, and before you could say Jack, it has triggered some sexual stimulation. So, and all these things will activate the parasympathetic reflex. Since we are concluding, I just want you to take these ones. So sexual stimulation could be visual, could be tactical, and tactile means touching the body tree and what have you. Once that happens, they trigger the parasympathetic pathway. And remember, you said the overall, but as soon as the parasympathetic pathway is activated, they also now will also cause the release of nitric oxide by the neurons. And the nitric oxide will now also act on GMP, and that's one cyclic. Excuse me, let me try. So here we are saying that the sexual stimulation will activate the parasympathetic reflex or the pathway. Parasympathetic pathway will also now cause nitric oxide to be released as a neurotransmitter. This is a major key neurotransmitter. What is the nitric oxide? Nitric oxide will also now act on CGMP. This is cyclic guanosine monophosphate. And it is this one which will act on the smooth muscles. And once the act on smooth muscles, to cause the smooth muscles to relax. And here we are talking about the smooth muscles within the penis. Here, the major target is your arteries. So the arteries will get relaxed. Once they relax, they become dilated. Blood will flow in there, and the cycle, as we talked about, will follow in that order. Right. So still in summary 2 of all that we talked about. So if there's relaxation of the recurrent arteries, it allows the influx of blood, filling the sinuses of the corpora cavernosa, and then erection will occur. So filling and dilatation of the corpora cavernosa causes a compression of the venous outflow. This too, like I've said over and over again, it is a summary of all that you said. So there's also this veno-occlusive mechanism. The arteries become dilated, become bigger, then they will impinge on the veins. And the veins will now appear to be collapsed. Once there is that kind of thing, there's occlusion. I mean, there's blockage of the veins. So the veins are supposed to take blood out. Once it has been occluded, okay, then it means that all the blood which has come into the erectile tissue will remain in there. And for as long as there's that occlusion, then the penis will remain erect. Okay. Now, the parasympathetic reflex also stimulates the bubourethral glands to lubricate the glands. I think this one is just an additional information. And the parasympathetic nervous system will also trigger the bubourethral glands also to lubricate. And we know that in this case, these glands, they are and the membranous urethral portion, and then they will lubricate the urethra so that if there should be erection, if there should be ejaculation, then that can also follow suit. Okay, I'm sorry, I think I went off briefly. So I'm sure by now, and with the summary, you can appreciate the physiology of erection, which is a normal phenomenon with the penis. So let's look at, say, the penis, other physiological phenomena, other things which are also normal. The major physiological normal thing is the erection. And we've gone through all the things that will cause the penis to become erect, and under what circumstance to become erect, and everything that there is in there. All right. So what are other physiological things? Other things that are also normal with the penis. Remember, we said that you also have time to look at the abnormalities. Today is simply on the normal things associated with the penis. All right. So you also have nocturnal penile tumescence. Remember, we said tumescence is the clinical word for erection. All right. So erection during sleep or upon waking up are known as nocturnal penile tumescence. Very simple. And it is normal. Because if you don't take care, the women, when they have their children erecting at night, say, oh, we are craboni, you are dreaming about some sexual something. It is very normal physiological phenomenon with every male individual. So don't go and beat up your boy for having erections at night. It's very, very normal. All right. So erections during sleep or upon waking up are known as nocturnal penile tumescence. Like I've said, tumescence erection. So nocturnal penile tumescence is not a result of sexual arousal or having a dream related to sex. Instead, it is a normal function of the male reproductive system. So you see that I'm bolding this one. All right, because we don't want a situation where somebody would think that, oh, because you have erection in the night, it means that you are thinking about somebody else. No, it is very, very normal. All right. So during sleep, remember, there's a shift of sympathetic to parasympathetic. I'm sure you can appreciate this one. During sleep, no, the sympathetic nervous system is in play during the day. All right, because you'll be moving, you'll be doing this. That's the fight and flight mood. You'll be doing this and doing that. So the sympathetic nervous system dominates the day. All right. So when you sleep, you're at rest. Then, of course, there's going to be a shift from sympathetic nervous to parasympathetic. I think this one is also very, very normal. Okay, during the night as you sleep, activities have gone down, and therefore the parasympathetic activities will dominate. And remember, look at all the things that you said. The parasympathetic listen promotes relaxation. muscle relaxation. And once muscle relaxations are promoted, then definitely it is going to trigger the principles that, or the processes that facilitate erection. I'm sure this is simple that any scientist should be able to appreciate. During sleep, there's a shift from sympathetic activities or stimulation, which is the fight and flight. And remember, we said that if you want to remember sympathetic, talking about stress. Stress means whenever you are stressed out, you want to move out, you want to do blah, blah, blah. And this is what people normally call a fight and flight mode. So you're always on the move, right? Now, parasympathetic is the opposite with paralyzed. When you are paralyzed, you are at rest, you can't do anything. So you are either at rest or digestion, blah, blah. So those are the things that will happen. And in the night, the parasympathetic activity will dominate. And just going back to all the discussion that we have had, parasympathetic activity promotes or is a pro-erectile. All right, so it will now lead to, so it is normal. It's something which is normal that this should happen during that. So nocturnal penile tumescence is due to the shift in balance. So the shift in balance drives the sympathetic nerve response that results in the erection. I'm sure this one, everybody now can appreciate it. When you sleep, there's a shift of sympathetic activities to parasympathetic activity. Parasympathetic activity causes relaxation. So muscles are relaxed generally, including the muscles in the penis. And we know that relaxation will cause dilatation of the arteries, which will lead to inflow of blood into the penis. And for that matter, engorgement. And engorgement will cause the penis to enlarge, it will cause the penis to become stiff. In the process we call erection. This is spontaneous and does not require being awake. All right, so it's not like, oh, the person is asleep, he's waking up and he's thinking about some girlfriend. That is why there is an erection. No, that's not. It is the street people who think like that. But you and I, who are scientists, I think that should not be our explanation. All right. So regular episodes of NTP, and for that matter, nocturnal penile tumescence, are a sign that the nerves and blood supply of the penis are healthy. I think this one is also important. Once you sleep and you can have erection, even when unconsciously, it means that the sympathetic, parasympathetic pathway is well under control and is actually leading to the nerves actually responding to that phenomenon where nitric acid will produce, and then they will cause further muscles to be relaxed, and therefore the penis should listen. So what it means, therefore, is that if, let's say, there's a doctor who is treating somebody for erectile dysfunction, if the person can say that, oh, in the night, sometimes I wake up and then I have erection. Meanwhile, when I wake up and I want to have sex with my partner, it means that the cause of this one is likely to be psychological rather than physiological. Physiologically, the person can have nocturnal penile tumescence. It means in that state, it is not under your control of sexual arousal or anything. No, that's not the case. So it means that once you can have erection during the night without you thinking about it, it means that your blood supply, your nerves, and the penis itself, there's nothing wrong with it. However, you wake up and you want to have an affair with your partner, with your woman, and the Kofi will not wake up, then it means that the cause of your inability to erect is not physiological. It is psychological. It's very, very, very highly likely to be psychological. So any doctor who is just probably taking care of you with erectile dysfunction will not tell you that, oh, probably the cause is not, you don't have any problem physiologically. Are you sure you love your woman? Are you sure? Then that's when the problem will come from, and then you can begin to address the situation from that point. All right. So the nocturnal penile tunescence, it is not just in the night, but even early morning. Sometimes you hear those people who sell traditional medicine, they will tell you that, oh, if you wake up as a man, if you wake up in the morning and you don't erect, then you are not a man or something. I mean, they use that one. I mean, so the morning erections are part of the NPT, the nocturnal penile tunescence, just as you wake up. So erections, morning erections can be due to hormonal fluctuations. Remember, we said that in the night, it's likely to be a shift from the NTP, the NPT is likely to be a shift of sympathetic to parasympathetic. That's the likely phenomenon that is driving the NPT. Now, in the morning, early morning, okay, somebody's asking at what age that NPT stops. Okay, right, we explain that. So the MPT, it also includes morning. And in the morning, the process is likely to be due to hormonal fluctuations. All right. It has been known that erection is also influenced by testosterone. All right. You can't explain erection just by one procedure or by one process. It's a complex thing. All right. It's a complex thing. So depending on the situation, you have to find the most suitable mechanism that is driving the erection. But in the night, we said that it is mainly due to the shift from sympathetic to parasympathetic. That appears to be the most probable explanation to that. In the early morning, it is due to hormonal fluctuation. It's been known that testosterone level is at its highest in the morning after you wake up. And it has been also known that, when we do the endocrinology of the male reproductive system, we are also going to look at the hormones and the effects. We're going to talk about the testosterone. You see that it has a huge impact on a lot of activities including your sexual drive, and for that matter, erection. So testosterone has effect on erection. And it's been known that testosterone levels are highest in the mornings. So that abnormal surge in testosterone early morning could account for the erection that you experience in the morning. But however, the morning erection is also considered as part of MPT. How the point is clear. Technically, as soon as you wake up, it means that you are waking up, and it appears that is still considered as part of the activities of the night, and it's still part of the nocturnal penile tunescence. But the early morning one, the erection in the early morning one is explained by the hormonal fluctuation, especially the testosterone level, which is highest in the morning. It could also be due to a full bladder. If the bladder is full, it could give you an erection. Or if somebody accepted some touch, if you are sleeping with your woman and then gives you some small touch, sometimes it is considered as some it is erotic of a sort, and then you begin to jack up, and then that's it. So All those things are part of nocturnal prenatal emissions. Now, so here it is a point that the increase in testosterone alone may be enough to cause an erection, even in the absence of any physical stimulation. So this explains the early morning erections, which is also part of the nocturnal. So NTP, for that matter, nocturnal prenatal emissions or this kind of erections resolve within minutes of waking up. They resolve very quickly. And so you don't expect it to be on a. So there's a question on the chart which is asking at what age. Normally, testosterone levels will decrease with age. That one too is a known fact. All right, testosterone level will increase. And remember, when we come to deal with testosterone itself, you see that it also has an influence in your sexual drive. And then once your sex drive, testosterone goes down, your sex drive will go down. And of course, it can also affect your erection capacities and of course your nocturnal prenatal emission. So it depends. As for age, I cannot put an age to it, but normally from 45 years going, testosterone levels will begin to go down. It's a known fact. All right. As it begins to go down, then all the things that you're talking about, your sexual drive, your libido, and all those sort of things will also begin to dwindle. And for that matter, your nocturnal prenatal emission episodes is also likely to dwindle. All right. And then that is it. If you wake up in the night and you touch your wife and then you get erection and you want to have, that is not part of NPTs. NPTs unconsciously, you yourself, you are not aware. Before you wake up, you see that the thing has jacked. Not that you saw your wife or you touch your wife in the night and then you get erection and then you say this NPT. No. Anyway, I'm sure you have all understood the principle of the NPT. This is some on sexual arousal and sexual flash. Sexual arousal refers to changes that occur during or in anticipation of sexual activity. All right. Sexual flash, increased blood flow leading to reddening of the skin, response to sexual arousal. These are terminologies. And I'm bringing them here because they are all normal things that are associated with the penis. All right. They are all very normal things that are associated with the penis. So that's why I brought them here. So the last thing here, we want to talk about normal things about the penis is the ejaculation. The ejaculation. Right. So we're going to talk briefly about the ejaculation, and then that brings us to today. I don't want to mix the normal things with abnormal things. All right. So that tomorrow we're going to start with the abnormalities or the disorders, diseases, conditions that affect the penis. All right. So it makes today's discussion very short, but I'm sure you have all appreciated it. So the ejaculation, of course, is the expulsion or ejection of semen from the urethra out of the penis. All right. And remember, we said that with the sympathetic and parasympathetic, this is promoted by sympathetic stimulation. Because here you need energy, you need force, you need the muscles will have to contract to push it. And so it cannot be on the parasympathetic stimulation. All right. So that's the big difference between ejaculation and erection with respect to the autonomic nervous system. So it is usually the result of sexual stimulation accompanied by an orgasm. Okay. Right. The ejaculation may occur spontaneously during sleep. And you remember we said that during sleep, you can have erection, which is normal. And sometimes before you could say jack, it is also accompanied by ejaculation. All right. And that's nocturnal emission, or what we call wet dreams. This happens especially when you have not had sex for a very long time. If you haven't had sex for a long time and you get nocturnal penile emesis, it's likely to be accompanied by an ejaculation. Remember, we said that once the sperms have been produced, they are stored, and the fact that you have not ejaculated does not stop the testes from producing more sperms. It has to be producing every day. So it's producing. So whether you are allowing some to go or not, that's immaterial. So you see that a time will come where a chunk of sperms will be locked up at the cauda epididymis. That's the tail end of the epididymis. You remember I said that once that happens, then some of them will push into the proximal portion of the vas deferens. And with the least amount of agitation, they will push up into the ampulla and of course into the ejaculatory duct. If you don't have enough stimulation to cause ejaculation, then they will just go into the seminal vesicles and also be stored there. So there's a likelihood of the semen coming out in the night if you haven't had sex for a very, very, very long time. And that's the nocturnal emission or wet dreams. As for the ejaculation, as for the erection, it has nothing to do with whether you have had it long or not. No. As for the nocturnal, listen, it's a normal phenomenon, it can happen. But for the ejaculation accompanying it, it will only happen when you haven't had sex for a long time or you have not ejaculated for a long time. So it will come automatically. All right. So that is what you have to know. So there's ejaculatory inevitability. It is the onset of orgasm and at the point at which semen must flow with or without further stimulation. That's if sexual stimulation ceases. Remember, we said that sometimes you come across a certain lady or you are even there, you think about, now talk about erotic fantasies. You're thinking about some lady that I wish this lady by me. Before you could say Jack, you have erected. And then once it goes on and you're thinking about it, then it comes along with ejaculation. But if what is driving your sexual arousal is not continued, you will see that ejaculation is the thing coming out of the penis. If it doesn't come out of the penis, then it can be locked up somewhere, and that can create the condition that yesterday I hinted about, the epididymal hypertension, which you call the blue balls. So occasionally something can happen, and then all of a sudden there is a cessation of what is stimulating you to ejaculate, and then ejaculation will not occur. If ejaculation doesn't occur, it is a cause of the epididymal hypertension, and it's also a cause of the semen or sperms being locked up in the seminal vesicles. All right. Now, but when it comes to ejaculatory inevitability, inevitable means that it will happen no matter what. So when you are into a sexual activity, and then at a point you are about to ejaculate and you stop. You stop even you're having a sexual intercourse, and then at a point you stop. If it has gotten to the point of orgasm, even whether you stop it or not, ejaculation will occur. That's what they call ejaculatory inevitability. I hope the point is clear. Ejaculation, you know that I'm saying at a point, if what is stimulating or what is driving the ejaculation stops prematurely, then probably you will not ejaculate. I'm sure that some men have this kind of, some men who and when it comes to premature ejaculation, it falls under abnormalities. So under our lecture on, let's say, conditions and disorders, we will talk about premature ejaculation. Sometimes some of the way people want to avoid premature ejaculation is that, oh, during the sexual activity, then you just stop and think about something else. You see, when you take your mind off the activity that you're doing, sometimes it prolongs your ejaculation. Right. What I'm saying is that there is this principle of ejaculating inevitability. That is, sometimes it gets your point. When you stop the activity or not, ejaculation will happen at all costs. That's what we call ejaculatory inevitability. So it is important to know this, because sometimes if it comes to when you're going to do semen analysis, and our first option is to, in the collection of sample, is to advise the client to masturbate. Sometimes if the patient says, no, no, I've tried it several times, I'm not able to masturbate, then you go to what you call coitus interruptus, where you have to have sex. And when you feel that you're about to have orgasm, and then you withdraw it. You are using the principle of ejaculatory inevitability, that at a point that you are about to ejaculate, if you remove it, it will come at all costs. But if you also remove it before you reach the point of ejaculatory inevitability, you remove it, the semen will not come out, because you didn't get to a point at which you have reached orgasm. But once you reach orgasm, whether you remove it or not, the semen will come out. I hope I've made myself very clear. That's what we call ejaculatory inevitability. At that point, if you remove it, if you withdraw your penis, at all costs, the semen will have to come out. If you don't get to that point and you remove it, the semen will not come. Because what is triggering the stimulation has been stopped, and therefore ejaculation will also have to stop. I hope the point is clear. Good. Our last slide, I didn't even finish with this one, because that aspect will actually feed into semen analysis proper, or collection of semen. So this one will be our last point. Just to say that ejaculation, the flow of semen out doesn't occur like as if you are urinating. When you are urinating, you start and end, the flow will just come out. Rather, you have what we call fractionated ejaculation. When you are ejaculating, it doesn't come out in one stream. It comes out in what we call spurts. Spurts, and normally what the example I use is when, if you have witnessed let me use goats, because orthodox, once they are having it, no, even if you drive them away, still have them intact. But for goat, if a goat is having an affair with a she goat, and then you drive them away, you will remove the male goat will just, then you see that if you are releasing the semen, you see that they are coming out in bits. You call them spurts, spurts, coming out in spurts. The same thing, that's the same thing that happens with the human beings. When you are ejaculating, it doesn't flow like a stream of urine. It comes in spurts. And we say that they are fractionated. So it comes out in 4 different fractions. Okay, comes out in 4 different fractions. And the first fraction is called the pre-ejaculative fraction. And of course, like we described the other time, this is a fraction that will come out from the bubourethral gland. And that one is supposed to prepare even the urethra. So that's the first fraction that will come out. Second fraction will come out from the prostate. The next fraction will come out from the seminal vesicles, and then the last fraction. So you talk about all those fractions during semen analysis and the collection. But I just want you to appreciate the fact that during ejaculation, the semen doesn't come out like as if you are urinating. It comes out in spurts and in fractions or in portions, and in 4 different portions. And each portion has what is in there, which you will describe in details during semen discussions. Thank you. We'll bring our session for today here. And I'm hoping that you have learned something. Any question, please? Any question, any suggestion, any input?
Hello, sir. Hello.
Oh, this is interesting. Michael Akwado, the 100 meters speed during ejaculation. All right. So during ejaculation, like I said, ejaculation is under sympathetic activity. Okay. Ejaculation, erection is under parasympathetic. Yeah.
Hello. Hello.
Sorry, my line temporarily went off. So I'll come to you, but I'm just trying to explain what was put on the platform by Michael Akon. Said he wants to know what triggers the 100 meters speed during ejaculation. It looks funny, but my explanation to that is that, as he said, the ejaculation is under sympathetic activity. And sympathetic activity has a lot of energy, uses a lot of energy, consumes energy. It causes heartbeat, increased heartbeat. That's why you see sometimes some old men with hypertension, if they get some young girl, before you could say Jack, they are dead in the hotels. If you have hypertension and then you are enjoying so much, if you are ejaculating and you don't take care, if you don't take care, you lie, because you already have hypertension. Ejaculation is got to do with sympathetic pathway. Sympathetic pathway is a lot of energy. You are using a lot of it. It causes increase in heartbeat. So if you already have hypertension and you have this increased heartbeat, what will happen? You collapse. So the normal sexual activity, once you are ejaculating, you are switching from the parasympathetic, which is the erection, which is driving the erection, to the sympathetic, which is driving the driving the ejaculation. I hope that you can differentiate the two: ejaculation and then erection, sympathetic and parasympathetic. Parasympathetic drives erection. Sympathetic pathway, even though the name looks sympathetic, it's not sympathetic at all. It is causes a lot. That's the fight and flight. It causes a lot of, and so that will account for the 100 meters speed. Michael, I hope I've done my best to that. Kuda's hand was up. What is it?
Yes, sir.
Kuda, I can't hear you all. Is it from my end?
Hello. Hello, sir.
You can put it on the chat. If
Hello.
yeah, Kuda, let me hear you.
Yeah, thank you, sir. Yes. I want to
Unmute
ask,
and then speak
at
out.
what age does enlargement, elongation of the penis stop? And two, taking other drugs or herbal
Yeah, your hand is
which
up.
aspects?
If you have challenge,
Hello.
in fact, if you are speaking, unfortunately, I can't hear you. If you're also not speaking,
Hello.
so if you are speaking, I'm not hearing you. You can put on the chat.
Okay.
I'm sorry, Kuda, if you are speaking, unfortunately, I can't hear you. I'll encourage you to put it on the chat. Oh, have you done? Can we go out? Any question? I'm sorry if it is from my end. I can't hear anybody speaking. If it's from my end, unfortunately, I can't hear anybody speaking. If nobody is speaking and nobody's putting anything on the chat, then I assume that we are done for the day. You can call it a day. Okay, I think Kuda is saying, at what age does the enlargement and elongation of the penis stops? And those who sell herbal medication to the effect, which part of the penis is it targeted? All right. As for, we are going to talk about the size of penis in our next topic, which will be under disorders of the penis. Remember, we said that today we didn't want to combine disorders with the normal. That's why today's discussion appeared to be short. So as to the penis enlargement and the size of penis, we talk about that in our discussion on the disorders. So I will encourage you to join us tomorrow as we do the disorders of the penis. And then we can talk on that. As to the claims by the traditional medicine people, as for that, I don't know much, so I can't speak to it. But you are a scientist. Sometimes when you are listening to them, you know what they are talking about, whether it's scientific or not scientific. That's why some of these discussions are important, so that you'll be able to differentiate between what is true and what is not true. All right. So you need yourself to be educated in this area, so that when they are speaking, you will appreciate whether the person is speaking science or just speaking rubbish. All right. Thank you. So sorry, I'm not going to answer you, so that I will not take away the shine from tomorrow's discussion, which will dwell on disorders of the penis. There's a lot of things you have to know about the penis. Remember, this is just the penis. When we finish, we talk other organs, so one by one, and then you'll be done with that before we move to the semenology. All right. Thank you for your time, and hope to see you tomorrow.